Well, tomorrow, the 29th of November, is the cut-off date for written submissions on the national health insurance. South Africans are being called upon to make their voices heard and submit their views and comments on the health plan. Submissions on the NHI Bill must reach Parliament by tomorrow, we understand. To shed more light on the deadline, we're joined in studio by the ANC NEC Head on the national health insurance, Dr. Gwen Ramokgopa. Doc, thank you very much indeed for coming through.
Thank you very much, Blaine.
Let's just talk about the submissions thus far.
Yes.
How many have you received?
Well, if you talk about the African National Congress, the issue of the NHI has been on the agenda since the African claims, the Freedom Charter, and in almost every conference that we've had, our branches have been saying their communities want the NHI. And with the manifesto of 2019, the message is very clear that by 2026, every South African must be registered for the NHI. So we're really grateful that the executive, under the leadership of President Ramaphosa, processed this, and the minister has tabled this to the Parliament. So the deadline tomorrow is for those that want written submissions to be with Parliament, and the ANC will be one of those. We also will be meeting the deadline of written submissions, but before then, we've been all over our country through the sectors, public, private, business, civil society, consulting, and we've been encouraging everybody to send their submission to Parliament. So, and many have confirmed that they've sent submissions in support of the bill.
You would no doubt agree that there's a lot of grey areas, especially in the public's mind, with regards to NHI, not fully maybe understanding what it's all about. What are some of the concerns that you're getting with regards to these public engagements?
One thing that we would like to guide the society about is that the NHI is actually a catalyst, it's a financing model for the universal health coverage, which must deliver quality health care for all, regardless of social standing. And that's a human rights issue. It's for social solidarity and also efficiency in the health system so that it be sustainable for all of us. So it is important that when people are concerned, some people are concerned about health professionals going away. I think if you look at, for instance, Britain, that has introduced universal health coverage immediately after post-World War. There was no big economy to talk about, but it was based on the principles of health for all is a fundamental human rights for every citizen.
But can you equate the first world country of Britain to South Africa?
My point indeed. Britain introduced the NHI equivalent universal health coverage before it became this big first world, post-World War, when there was not much of an economy to talk about. So for South Africa, we have about 8.5% of our GDP spent on health. And that should be, and that is above the WHO recommendation of about 5. So we are going to look at that as a way of making sure that we have health for all South Africans, quality healthcare for all South Africans.
You're getting some pushback though. The DA released a statement saying that they will hand over thousands of objections to Parliament. I'm just reading their statement here. They said that using their online portal, they received 80,000 submissions from members who have serious concerns. Would you concede that there's still lots of work to be done on this bill?
Well, there are powerful forces that may stand to lose. For instance, those that are raking billions of profits out of the health system. I think society must remember that this may, like the maybe private health groups, and that money is not going back into the health system. It's going into profit margins of individuals. So, so those ones, yes, they stand to lose, but we are really asking them to consider health, human rights, life before profits. There will still be profit to be made. Government won't be making manufacturing machines. They can get into that sector. Government won't be manufacturing tablets. They can get into those sectors and many other supporting sectors to the health system. But when a patient comes to the doctor. You don't have to negotiate the cost. Free at the point of service. Prepaid, free at the point of service.
So will it be mandatory that every employed South African will have to contribute to NHI?
Yes, every employed South African and every employer will contribute to the NHI fund. That would also improve productivity for our economy. But what is different with the current medical aids is that there are bits and pieces of medical aids everywhere, and many of them are not sustainable. My experience also when I was in Gauteng is that those people who are working who could afford medical aids were becoming lesser and lesser. And again, getting into the public sector as well. So we want to level the playing field. We want to stabilize both the public and the private sector to ensure that both the public and the private sector can be service providers to our people.
So will there even be a need for medical aid? Why should I, as a citizen who is, contributing to NHI, fork out more for medical aid?
Well, if you would like your nose to be sharper,
I would.
Yes, the medical people, plastic surgeons, are there to assist, I guess, but that won't be covered.
So going over and above?
Going over and above, yes, what is covered by the NHI fund. South Africans will be free to top up, but the first contribution will be to the NHI fund.
What's been your interaction with the medical aid companies?
Yes, the medical aid companies, many of them, there are different types. There are the medical aid funds who hold funds on behalf of their members. They are under a lot of pressure as well because many of them don't have adequate reserves. And we're going to leverage the lessons from there. And there are medical aid administrators. I know medical aid administrators are saying to government, can we be part and parcel of the solution, use our expertise to help administer? And that, although it is not explicit in the Act itself, is a consideration that can be given to the minister once the Act is passed.
Are you getting a lot of pushback from medical aid, or is it?
We're getting a lot of pushback from many powerful people who have had. Some people actually say it was easier to get return on your investment, quicker, easier, sustained, even in a recession from the health sector. And it is because health is a public good. Unlike when you want to buy a cell phone, you look at the depth of your pocket. But if you get involved in a car accident, there's no time to think about where am I going to. So the free market system is not ideal for health as a commodity, and that's why social solidarity is important.
Every time I do an interview with regards to NHI, and especially with role players like you, I want to take it back to the basics so people have this understanding of what this will entail. When somebody has been registered for NHI, they receive a card. Can they go anywhere in terms of any clinic, any hospital, and receive free treatment?
Yes, ideally you need to go to where you reside. I mean, it's because but if you are anywhere else, you can even be able to access your records. Sometimes patients forget the name of my treatment. With your access to your own records anywhere in the country, you can be able to do that. Doctors who would also be accredited to access record, we will see who has accessed your records from the security, will also be able to provide you better care. You won't have to do many investigations. If you've done a CT scan in the past 2 days, the same CT scan can be used to give you quality care.
Doc, thank you very much indeed for coming.
Thank you very much. We call on all South Africans, those that have, we thank you for submitting, and those that haven't, you still have today, and please make sure that by tomorrow you have sent your support for the NHI Bill.
All right. Appreciate it. Thank you very much. We will no doubt have you back here because I think we need to carry on talking about this to get South Africans, giving them a clearer picture with regards to NHI.
Certainly.
All right. Thank you very much indeed. ANC NEC Head of the NHI, the National Health Insurance, Dr. Gwen Ramokgopa.